Certain individuals, especially in certain breeds, are genetically programmed that they're susceptible to getting cancer, and there are likely environmental cancers. The same way that, if you have lung cancer, you've been a smoker, we know why you have lung cancer. If you've been sitting in the sun, you have melanoma, we know why you have that cancer. But let's say that you get an adrenal cancer or an intestinal cancer. No one would be able to tell you why you got that. The other thing that you're going to see a lot online is what I refer to as anecdotal information. Let's say that a dog was having a cough, and the person during the cough switched the dog's diet to nothing but sardines. And then that person is going to go online and say, hey, if your dog is coughing, feed your dog sardines. That'll get rid of the cough. That's what we call anecdotal information. It's amusing, but what you really want to rely on is what we call in the profession evidence-based medicine, which means that there's data to support that, in fact, when you took 20 dogs that were coughing, you fed half of them sardines, half of them you fed them the regular dog food. There was no difference in whether or not the coughing got better. That's the kind of data you're going to want to look for. And if you find stuff on a veterinary college website, that's the kind of information that you'll find. So serve to your heart's content, but use some discretion in terms of how you use your veterinarian's valuable office visit time. Many veterinary hospital visits are no more than 10 or 15 minutes. It's a lot to cram into one visit. It's perfectly reasonable to be able to access the entire veterinary hospital. You know how when you're in there and your veterinarian or the nurse says, I'm just going to take Scruffy to the back for a toenail trim. The back of the hospital. Well, what is in the back of the hospital? Aren't you curious? Don't you want to know? Ask for a tour. You want to see the operating room. You want to see where your dog would stay if your dog were staying in the veterinary hospital. So that's a reasonable expectation. And that's a new expectation. Many people are happy to just see the waiting room and the exam room. I would say see the whole hospital. Why not? It is perfectly reasonable, and I implore you to expect that there should be discussion about which vaccinations your dog is getting. We've really been over-vaccinating our dogs and our cats. And the major players, distemper and parvovirus, the vaccines we used to think we had to give once a year. Well, guess what? The immunity from those vaccinations lasts a minimum of 3 years. And for some dogs, they even last lifelong. So when you go into the veterinary hospital, it's important to say, what does my dog really have exposure to? Even though your dog doesn't need vaccinations yearly, your dog should still have a thorough physical examination every year to discuss parasite control and nutrition. And we're here all because we want to help cancer research. Any tumor you can describe, just about any tumor you can describe, the earlier we know about it and treat it, the better the prognosis. If you bring your dog in once a year, part of the physical examination is palpating the mammary chains and seeing if there's any lumps or bumps.
There are lots of treatment options that are available for canine cancer, and just because your dog has a diagnosis of cancer doesn't mean that there isn't a lot that we can do. And our posters here just show some of our recent survivors and dogs who've done really well with their treatment, and we just want to let people know that if they need us, we're here, and there are lots of treatment options available, so stay positive.
You are entitled to know that you have access to specialists. I know, it's self-propaganda, I'm one of them. You have the option to get second opinions. If your gut is saying, maybe I want to get a second opinion on this. If you want to incorporate Eastern medicine into the Western medicine protocol, Dr. Kent and I both treat a lot of cancer. Many people want to do combined therapy where they're seeing someone who practices alternative complementary medicine that really can successfully mitigate side effects sometimes of the traditional therapies that we're doing to treat cancer. It's perfectly fine to have the expectation that you can be referred for any of these things. Sometimes it's a little bit difficult to start conversations about second opinions. People are really worried about hurting their veterinarian's feelings. And what I ask you to really think through logically is what's more important, your veterinarian's feelings or your dog's health? So if you've been to your veterinarian to try to get the diarrhea resolved It's the 6th visit. It's still not resolved. It's getting worse. It's time to broach the idea of a second opinion. That's a totally reasonable expectation. It might be a reasonable expectation after the 2nd visit rather than the 6th visit. Be aware of all the modern, what I call technology, wizardry, and gadgetry. You have the right to expect that every option, all the modern options and all the more old-fashioned options can be discussed. And you see, your veterinarians are all part of your dog's health care team, but you all are the team captain. That's a heavy role to play, but you're going to be real happy when you've done that because you know your dog better than anyone else. And if you're a good medical advocate for your dog, 1, you're going to make the best choice for your dog, and 2, you're going to walk away when all is said and done. Even if the outcome isn't such a good one, you're going to come away with the best long-term peace of mind possible. Nowadays, it's perfectly acceptable to purchase your dog's long-term prescription medications at sites other than the veterinary hospital. You're entitled to cost estimates beyond the office visit. Before anything is done, you're entitled to a written cost estimate. Many veterinarians offer them forth. I always do. But some veterinarians don't. How else without an estimate could you know if your bill is going to be, when they take your dog to the back of the hospital, how could you know if it's going to be $200 or $2,000? Trust me, every veterinarian is very used to people being mighty concerned about their bank accounts these days. You have the right to know the risks and benefits and the costs of all of those options. For those of you who are inclined to, with your dogs, to do the everything possible for your dog approach, I encourage you to look into pet insurance for your dog. There's a whole section of questions in the book to ask pet insurance providers to help you hone in on the company that's going to best suit your needs. 98% of you sitting here are going to have to go through the really, really monumental decision about how to handle things at the end of your dog's life. When is the right time? That's the big question. And then beyond that, you really should be able to expect to talk with your veterinarian about what are the options for where the euthanasia will take place. So you have the choice to talk about where will this take place and who will be present. If you encounter a veterinarian who doesn't want the human members of the family there, I say move on. You're with the wrong veterinarian. You have the right to be present. You have the right to discuss, do I want sedation on board beforehand or not? And how will the remains be cared for? Do you want a paw print? Do you want a lock of hair? Those are all very reasonable expectations. And if for moral, philosophical, religious reasons, you can't bring yourself to euthanize your best friend, there's a reasonable expectation to talk about hospice care. And hospice care is very similar to what it is in people. It's a way of keeping the patient comfortable, oblivious to pain, and the human family as emotionally comfortable as possible.